Greetings to Prof. Jainal and my batchmate. My name is Florence, Year 1 Medical students. Today, I'm going to present my infographic, which is about the human heart. In this presentation, I will cover the anatomy, histology, biochemistry, physiology, disease, and a famous practitioner related to the heart. So, now I will start my presentation with anatomy of the heart. First, the heart is divided into 4 chambers, which are left atria and right atria, which is located at the upper part of the heart, and the left ventricle and right ventricle, which is located on the lower part of the heart. The heart is divided into 2 sides, which is left and right side by the septum. Now, let's look into atria. Left atria have smooth wall and has an auricle, while for the right atria, it has smooth posterior wall and rigid anterior wall. This posterior and anterior wall is separated by crystal terminalis, and this left atria and right atria is actually separated by the interatrial septum. Next, let's look at the ventricles. Ventricles are lined with muscular ridges called trabecular cornea, and the ventricles is separated by the interventricular septum into left and right sides. So, in our heart, we also possess the valve to prevent the backflow of the blood. The heart consists of 4 valves, which are the atrioventricular valve and semilunar valve. Atrioventricular valve consists of tricuspid, which is in the right side, and in the left side, we have bicuspid valve. For semilunar valve, it consists of pulmonary valve on the right side and aortic valve on the left side. Other features of the heart are: the heart has auricle, which function to expand arterial volume, coronary sulcus, which function to groove separating atria and ventricular externally. And the last one are posterior and anterior interventricular sulci, which groove marking the position of the interventricular septum externally. Next, I will talk about the histology of the heart. The heart wall comprises of 3 layers, which are epicardium, myocardium, and endocardium. Epicardium is the outermost layer, which function is to cover and protect the heart. Mesothelium for epicardium is simple squamous epithelium, and the underlying layers consist of fibroelastic connective tissues and adipose tissue. Besides, it also contains blood vessels, which are coronary artery and veins, and also nerve supplying the heart. Next is myocardium. It is the thick middle layer of the heart wall, and its function is responsible for the heart's contraction and pumping blood. Myocardium composed of cardiac muscle tissue, which are arranged in spiral or circular bundle, and it also contains connective tissues that support blood vessel and nerve within the muscle. The last layer is endocardium, the innermost layer of the heart. It lines the heart chamber and valve to ensure smooth blood flow. Endothelium for endocardium is simple squamous epithelium, and the underlying subendothelial connective tissue contain elastic and collagen fibers, and sometimes specialized fiber like Purkinje fiber, which is located in the ventricles. Now, I will continue my presentation with biochemistry part, which will explain about cardiac action potential. Cardiac action potential are electrical changes in heart cells due to the movement of ion. There are 5 phases in cardiac action potential. The first phase is phase 0, where sodium channel open, allowing sodium influx and causes depolarization to happen. This eventually results in rapid increase in membrane potential. Next is phase 1, where sodium channel close, potassium channel open, and potassium efflux begins, causing slightly lowering the membrane potential. The next phase is phase 2. Calcium channel open and influx of calcium will balance the potassium efflux. Membrane potential remain constant. So, repolarization occurs in next phase, which is phase 3. Calcium channel close and potassium efflux continue, causing the membrane potential remain constant. The last phase is phase 4, where the resting potential is maintained by the sodium-potassium pump. To conclude, this cardiac action potential will drive the rhythmic contraction and relaxation of the heart to supply the blood to our whole bodies. For physiology part, I will present about the cardiac cycle. The cardiac cycle consists of 3 phases. The first phase is atrial systole, which lasts approximately for 0.1 second. During atrial the atria contract following electrical stimulation marked by the P wave on the ECG. This contraction pushes 70 to 80% of the blood from the atria into the ventricles through the tricuspid and bicuspid valve. This process ensures the ventricles are adequately filled with blood, preparing them for their subsequent contraction. Phase 2 is ventricular systole, which lasts about 0.3 seconds. This phase begins with the ventricles contracting after electrical stimulation, which is represented by the QRS complex on an ECG. This phase is divided into two stages. So, during isovolumetric contraction, the rising pressure in the ventricles causes the AV valve to close, producing the characteristic loop sound while no blood is ejected yet as the semilunar valve remains closed. In the ventricular ejection stage, the ventricular pressure becomes higher than the pressure in the pulmonary trunk and aorta. This allows blood to be pumped into the pulmonary trunk, directing it to the lungs and also into the aorta to deliver the blood to the rest of the body. The last phase is ventricular diastole, which lasting about 0.4 seconds. This phase occurs as the ventricles relax following electrical recovery represented by the T wave on an ECG. This phase is divided into two stages also. So, during isovolumetric relaxation, the ventricular pressure drops, causing the semilunar valve to close, producing the duck sound. At this point, all valves remain closed and no blood enter or leave the ventricles. In late ventricular diastole, as the ventricular pressure continues to decrease, blood flows passively from the atria into the ventricles, causing the reopening of the AV valve and initiating the next cycle of the cardiac process. For the disease related to the heart, I represent the most common heart disease, which is coronary artery disease. This disease will cause the coronary artery become narrow or blocked, and this usually due to fatty deposit building up inside the arteries, which is known as atherosclerosis. Symptoms of this disease include shortness of breath, irregular heartbeat, dizziness, and nausea. Treatment involved is to reduce risk factors like quitting smoking, managing health issues, exercising, and limiting alcohol. In serious cases, surgery such as coronary artery bypass grafting may be needed. Lastly, I will present about the famous practitioner in cardiology. Dr. Raymond Burke, who born on November 4, 1958 in Honolulu, Hawaii, is a renowned pediatric cardiovascular surgeon known for his expertise and innovation in treating complex heart conditions in children. He pursued his education at Portal Elementary School, John F. Kennedy Junior High School, Monta Vista High School, Stanford University, and Harvard University. Dr. Burke has made significant contribution to pediatric cardiovascular surgery, particularly in advancing minimally invasive procedures which have improved surgical outcome and patient care. His research includes exploring endoscopic technique for congenital heart surgery and designing specialized instruments and methods in the laboratory, further enhancing the field of pediatric cardiac care. In summary, the human heart is an extraordinary organ, both structurally and functionally. Understanding its anatomy, physiology, and potential disease allow us to appreciate its complexity and the importance of maintaining heart health. That's all from me. Thank you for your attention.